Thank you for joining my presentation on Dorothy Orem's self-care theory. We'll start by talking about what is theory and what is nursing theory. Theory is defined as a belief, policy, or procedure proposed or followed as a basis of an action. More specifically, nursing theory is an organized framework of concepts and purposes designed to guide the practice of nursing. These nursing theories are composed of concepts, definitions, models, propositions, and are based upon assumptions, help guide the decisions we make in our practice, and are used to build a basis for further research and innovation. So what is a theory? It's an attempt to describe or explain the phenomenon, the process, the occurrence of an event called nursing. More specifically, that's what nursing theory is. So what is a nursing theorist? Nursing theorists are clinicians or researchers that have developed these guiding thoughts and principles and combined them into the theories that we use today. The theorist that we'll review in the theory is proposed by Dorothy Orem. She was born in 1914 in Baltimore, Maryland, received her diploma in nursing in 1930, BSN in 1935, and MSN respectively in 1945. She held several different positions in nursing, including positions as a staff nurse in the emergency department, operating room, and surgical floors. She also held many different positions in nursing leadership as well as education at a number of different institutions. She was first published in 1959 with the development of Orem's theory of self-care. So what exactly is Dr. Orem's theory of self-care? It's a model focuses on each individual's ability to perform self-care, defined as the practice of activities that individuals initiate and perform on their own behalf in maintaining life, health, and well-being. And it makes three pretty robust assumptions. The first is that people want to be self-reliant in their own care and in the care of their families. An individual's knowledge of potential health problems is needed for promoting self-behaviors. And the development of self-care requisites is an important component in the recovery phase as well as the prevention of illness. And then finally, the role of the nurse is to intervene when the patient and family are not able to meet their needs. So the components of self-care theory are as follows. The first is theory of self-care, theory of self-care deficit, and the theory of the nursing system. Those three components comprise Dorothy Orem's self-care theory. So the theory of self-care, as we talked, is an individual's ability to engage in self-care. It's their ability to maintain life, health, and well-being. And these are the universal self-care requisites. Further, Dorothy Orem talks about these self-care requisites as the ability to maintain sufficient intake of air, food, and water, the unassisted continuous elimination, maintaining balance of rest and activity as well as social interaction and time to reflect, and then the patient's ability to identify potential hazards to one's health and promotion of human function. When one's not able to meet the self-care requisites, there's three steps they must do. First is identify there's a problem. The second is to seek appropriate medical attention. And then the third is to carry out necessary interventions to return to a healthy state or learn the necessary interventions to mitigate lasting effects. These really represent the actions of a typically healthy patient. The theory of self-care relates to a patient that has maybe a minor injury or minor illness that's able to fully recuperate and go back to taking care of themselves. It's their own ability to engage in self-care. This theory of self-care is deficit according to Orem. Nursing is required when an adult is incapable or limited in the provision of continuous, effective self-care. The theory identifies 5 models of helping, acting for and doing for others, guiding others, supporting another, providing an environment promoting personal development in relation to meeting future demands, and teaching another. So those are the 5 methods of helping according to Dr. Orem for the theory of self-care deficit. This identifies when nursing care is needed. An example of these might be a patient in an acute care or long-term setting, unable to care for themselves or have a family member care for them at home. And then the third part of this system, theory of system, is a nursing system. It describes how the needs of the patients will be met. So we talked about the patient being well and able to care for themselves. The second part of the self-care deficit talked about the patient needing assistance, and then the theory of nursing system is how the patient needs will be met. It could represent the collaboration between the patient and the nurse to meet their needs. Could be total care needs potentially. In these collaborations, the nurse continually takes into consideration the physical, educational, and psychological needs of the patient and adapts the plan of care accordingly to meet those needs. So there's self-care theory application. In nursing practice, we use this theory to identify the gaps in understanding, identifying barriers to wellness, whether that be economic or cultural or educational, as we spoke. This is how we assess our patients. We use the theory to set up nursing care plans based on this assessment. We look at what does the patient require, what's the level of care needed. Use the theory of nursing system to evaluate whether we are meeting a patient's goals and how the patient is progressing to a more healthy state. Application in nursing research has been quite a bit there. Many researchers have done studies to identify the gaps in understanding of self-care requirements and how this affects the patient's outcomes. Researchers have used this theory of Dorothy Orem's as well as a study process as an adjunct to help with communicating with patients. One quote I found in research says that Orem's self-care theory could be considered a valid instrument which helped to promote more objective communication between researchers and the research subject. And it's also been used to develop research interim tools. Application to nursing education helps evaluate again the gaps in understanding and set needs for education. Dr. Orem noted that our theory has also been used as a theoretical framework in nursing curriculum at numerous colleges and universities across the country. The model case for self-care theory was one that Dr. Jody Briggs produced in 2010, utilizing Dr. Orem's theory in evaluating quality of life in post-acute care setting discharge of heart failure patients. She found that patients that had a self-care deficit did not benefit from a single interaction with a nurse in regard to discharge instructions, including follow-up and follow-through. However, when the nurse utilized the nursing system and evaluated the reasons for the gap in understanding to include educational, economic, cultural, and other reasoning, and could intervene appropriately, those patients did have an improved quality of life and improved clinical outcomes. So more in the model case, it shows the ongoing collaboration between the nurse and the patient, continued education at each patient interaction, and improved clinical outcomes as patients had a better understanding of their care. In this model case, particularly those patients that had heart failure did not have an improved outcome when they had a single interaction, like the study said, with the nurse, but did have improved outcomes as the nurse educated the patient at each interaction as well. And there's my replication match. So thank you for taking time to review Dorothy Orem's self-care